I'm Guy Falzarano, and I am the CEO of Lightbridge Franchise Company. We're a childcare franchise organization. We've got 38 centers in New Jersey serving about 5,000 children. But I'm also the president of the Early Childhood Education Advocates, which represents the 4,100 licensed childcare providers in the state. And to just piggyback on some of the things that have already been said, we have an immediate need. The needs that have just been talked about by David and Paul are what's happening in the summer, what's happening in September. We're up against an immediate need right now because we're operating under restrictions that are limiting our capacity from anywhere from 25 to 37% in our existing childcare centers. Now, the childcare industry has gone through a devastating period operating at losses, and many childcare providers have gone under. We don't know exactly how many right now, but we do know that quite a few have not survived. We need to get those restrictions lifted because we're starting to turn parents away. Fortunately, parents are starting to go back to work. If you just go on the parkway at 4 o'clock in the afternoon and at 8 o'clock in the morning, you start to see traffic again. Those parents are starting to go to work. They need childcare. But unfortunately, we've got to turn them away because we're bumping up against what are arbitrary restrictions. They limited 15 children to a classroom, which was based on primarily the Department of Education saying that's what they would do in the public school system. The Division of Children and Families adopted those same regulations for childcare. The childcare industry is not the public school system. So we can't operate with those same restrictions. Children at the ages that we're dealing with have proven not to be spreaders of this disease or this virus. I operate in 5 other states and without restrictions, these restrictions, and we're not seeing any difference between those states and what we're seeing in New Jersey, other than the fact that we've got limited number of children that we can serve in New Jersey. So if we're going to save the childcare industry, and I think the childcare industry has such an enormous impact on the overall economy and people's ability to go back to work, we need to get these restrictions lifted. The other thing we need to do is we need consistency between health departments. It's obvious to us because we operate in 38 different centers in 11 different counties that we're not seeing consistent treatment among the different health departments. We've got some health departments that if a child has a runny nose, we've got to quarantine a classroom of 15 children. That affects 15 families. They can't go to work. 3 days later, we find out they just had a runny nose. And we've had to put those people out for that 3-day period. You know, it's just, and in other places, you've got to test positive before you quarantine a classroom. So it just, there's no consistency between the health departments, and maybe that's because they're not getting clear direction from the state. I really don't know. All I know is we're seeing a lot of differences between those health departments. So we need some clarity there. We need some consistency there. And we need to get these restrictions lifted because we haven't seen the restrictions that we don't have in place in other states have any material impact on what's going on there.